Hi, my name is Michael Acevedo. Today I'll be performing a IV insertion on my client today, as well as discontinuing the IV. Um, First, I'm going to go ahead and perform hand hygiene. Once that is completed, I'm going to go ahead and gather my supplies. I have my gloves, IV start kit, IV extension set, along with my saline flush, which is sodium chloride, 0.9%, and as well as my safety IV catheter. They are all right here. I have an 18 gauge needle, stuff like that. Now I'm going to go ahead and don my gloves. Now, prior to me entering the room with my supplies and everything, I did make sure that there was an order from the MD to go ahead and insert this IV line, along with introducing myself to my patient, Mr. Jones. Instructed him that I will be performing the IV insertion to his arm. Also verified his name and date of birth, and also asked him to repeat it back to me as an identifier to make sure I have the right patient. Once I did that, I'm going to go ahead and open up all the materials that I need for this procedure. I'm going to go ahead and open up my IV start kit. And then I'm going to go ahead and open up my saline. Along with my 18 gauge needle. Got that. Move it in here for now. Don't need it just yet. Next, I'm going to go ahead and prime my tubing with the saline to make sure there's no air or any bubbles in the line. I'm going to go ahead and open my extension kit. Trash. Gonna go ahead and remove the caps, making sure I do not touch the inside the cap of the sterile part. The trash. Go ahead and get my saline. Open it up to the side. Gonna go ahead and get the correct end. Place that lure lock end nice and secure. And of course, away from my patient, I want to make sure I don't get him wet. I'm going to go ahead and prime the tubing to make sure there's no air or bubbles in the line. Perfect. I'll place that back down here. Sure it's still clean, sterile. Next, I'm going to go into my IV insertion kit and get my tourniquet. Once I identify the site where I'm going to go be placing, I'm going to go to place the tourniquet about 4 to 6 inches above the insertion site, and making sure that it's not too tight. I'm going to place that there. Okay. For the purpose of this video, we're just gonna pretend, and I'm just gonna set it right here because I'm gonna have to remove that later. Next, I'm gonna go ahead and clean the site of insertion. I'm gonna go ahead and get my ampule of iodine. Follow the directions. Press where the dot is at until you hear the snap. Snap. Then you're gonna go ahead and get it. Remove it from the sleeve, put the sleeve in the trash, and then of course with iodine you want to clean your site from the innermost part to the outermost part. So we're going to go ahead and go to the site where we've identified, and then we're going to go out a circular motion. Perfect. Next, we're gonna go ahead and dispose of this in the trash. Once that's disposed of in the trash and it's away, we're gonna go ahead and get our safety catheter. And we're gonna go ahead and get that now. Safely removing the cap off of the safety catheter. I'm gonna go ahead and place this in the sharps container as well. Once that's in, I'm gonna go ahead and remember to keep the bevel up when inserting the catheter in. So now that I know there's a distal pulse, about 1 to 2 inches, I am gonna go ahead and place my thumb from the site and pressing the skin away from the patient. Again with the bevel up, and then about 10 to 30-degree angle, I'm going to go ahead and insert the catheter. I'm looking for flashback. Once I do see flashback, I'm going to go ahead and advance the catheter in about 4 centimeters in. Once I'm there with my non-dominant hand, I'm going to go ahead and place my finger top of the side of the hub. Then I'm going to go ahead and remove the needle safely. Once you have it removed, you're going to go ahead and press the button to retract the needle. Once that is done, I'm going to go ahead and place it in the sharps container. Once that's in the sharps container, you're going to quickly remove the tourniquet. Put that to the side. Next, you're going to go ahead and get your extension tube set and place it onto the catheter. And once that's nice and secure, I'm going to go ahead and draw back to see if there's any blood in the line. If there's any blood in the line, that means you're in the right spot, and we're good to flush. We're going to go ahead and flush the remaining of the sodium chloride into the vein. That is done. We're going to go ahead and remove the saline syringe. I'll put that to the side. Next, we're going to go ahead and get our sterile dressing. And then we're going to place that onto the patient's arm. Sure it's nice and secure. And then remove the backing of the tegaderm. Perfect. Put that in the trash. Okay. Next, we're going to go ahead and loop the extension kit right next to it. It's secure with tape. I did clamp it, of course, before. Forgot to mention that. For removing the syringe. Next, I'm about to anchor the extension tubing right next to the side of the tube and applying tape to this tube. Perfect. Once that is done, I'm gonna go ahead and label my tape with today's date. Today is June 24, and the time is 16:30, and I did apply a 18 gauge needle, and that was 18 gauge, and the length of it was 30 millimeters. Okay. Once I did that, I'm gonna go ahead and dispose of my trash. Throw that in the trash bin. And that's it. Next, what I'm gonna do next is gonna, of course, remove the current IV. I'm gonna go ahead and perform hand hygiene again. Wash, wash, wash. After that, I am gonna go ahead and apply gloves, clean gloves. I'm going to go ahead and explain to my patient, Mr. Jones, that I will be discontinuing his IV, that he no longer needs it. Verified his name, date of birth. He repeated it back to me again. Of course, made sure that there was an MD order as well to discontinue it. Apply my gloves. Finger. Once I've done that, I'm going to go ahead and carefully remove the tape or sterile dressing from the patient's arm. I'm going to go ahead and hold the catheter in place and just gently remove the tape off of the extension tubing. Place that there. Now we got that off. I'm going to go ahead and continue to remove the tegaderm off the client's arm. Go ahead and discard that. Holding this, I'm going to go ahead and now get my sterile gauze, and above the insertion site, I am going to go ahead and place this right there. Hold it with my non-dominant hand. Then I'm going to go ahead and withdraw the catheter slow, steady, and parallel to the patient's arm. So I'm going to go ahead and remove. Once I have it removed, apply pressure to the site the catheter was at. I'm going to hold it at that site for about 30 seconds. And then I'm going to go ahead and inspect the catheter tip that there's no breaks, and the length of the catheter looks good. If I did ever notice that it was out of place or a piece of it was missing, of course we would go ahead and call the attending physician, letting them know right away that the catheter tip was displaced. Once I go ahead and did that, I'm going to go ahead and discard it into my sharps container. And then with my finger still at the site, I'm going to go ahead and get another piece of gauze. Holding that there, noting that the bleeding has stopped. We are good. Throw that away. Next, I'm going to go ahead and get another piece of gauze, sterile gauze. I'm going to go ahead and fold it in half. Place it on the insertion site area. Get my tape. Secure to the patient's arm. Once I'm all done, I'm going to go ahead and discard all of my items that I used. And throw that in the trash. Tell the patient I'm all done. Go ahead and move all materials out of the way. Bring my sharps container out with me. Usually a plastic bottle. And all done. Oh, I'm sorry. Wash my hands. And that's about it. Thank you.